Hello, my name is Lori Reed. I'm a certified reflexologist and a holistic therapist, Indian head massage, and this is Dolly, my little doll that I use to demonstrate. I'm going to talk to you today and demonstrate to you how you can use reflexology to help you with your baby. Reflexology is very effective, very safe. You just need to know to use a very gentle, light touch when you're doing your baby's feet. So there are 7 key points that we're going to talk about today that would help you with baby's acid reflux, and we call that infant reflux. So there's going to be 7 points we'll be talking about. But before we do that, I'd like to just mention some of the signs and symptoms that may point you toward getting some help and finding out what's going on. And some of those signs and symptoms of infant reflux are that you might see your baby spitting up or vomiting. Baby might refuse to eat, may have difficulty eating, may have difficulty swallowing, is irritable during feedings, has wet burps and wet hiccups, doesn't gain weight, may have abnormal arching or stiffening of their back and pushing away, frequent coughing, gagging or choking, chest pain and heartburn. It's a given, but we don't know that's what it is. We just know the baby is very, very uncomfortable, and disturbed sleep. Now, these symptoms, if they're going to occur, generally occur around 4 months, and they generally go away around 18 months. So somewhere in there, if your baby's going to have infant reflux, that's when it would likely happen. And I mentioned to you that reflexology is a highly effective and very safe treatment to give your baby. And there are 7 points. And so we're going to talk about 7 areas on the feet that point to 7 key areas that would help baby deal with infant reflux. And those are the solar plexus, which is in the center of baby's chest and my chest, but on the foot, it's in the center of the foot, upper center of the foot. The cardiac sphincter valve, the large and small bowels, esophagus and mouth, neck and throat, pancreas and gallbladder. So those are the areas that we will talk about today, and we'll start with the solar plexus. And as I mentioned, solar plexus is located in the upper third part of the foot, and you always start on baby's right foot. Use your index finger, go to the middle toe of baby's foot, and just take your finger and drag it very gently down until you come to an automatic sort of natural indentation. And again, you're in the upper third quadrant of the baby's foot. And once in that spot, you're going to circle in a clockwise rotation. You're going to go around and around that area. You're not pressing hard, it's just very gentle. And you might say a little rhyme. Round and round the garden walks the teddy bear. 1 step, 2 step, tickly under there. And then you would repeat on baby's left foot, exactly the same spot. The next spot we'll talk about is the cardiac sphincter valve, which is located, and starting on baby's right foot, located between the big toe and the second toe, right in between. You start at that spot and just drag your index finger down to about the bottom of the third quadrant, and then back up again. And it's again very gentle. It's just a sweep up and down. And that's the cardiac sphincter valve. And you would repeat on baby's left foot. The next points are the points for the small bowel and the large bowel. Starting with the small bowel, we do a sweep with our index finger just over the bottom part of the heel, just the heel part, just sort of up and down and across. just sort of wiping very gently. And as you do this, always remember to breathe through your nose and out your mouth. When you do that, you just give baby the feeling that they need to just sort of relax. Mommy is relaxed and they're relaxed. So that's sweeping of the small bowel, small intestine. Then you're going to go and do the large intestine. And the large intestine does start on the right foot, and you come up from the medial side of the right foot. The outside part, I'm backwards looking at this. You come from the outside, and you're going to go straight up on the side of the heel. And when you get to the top of the heel, you turn and you go straight across. Again, you're using your index finger starting at the bottom of the heel up to the top of the heel and make a turn and go straight across. And you can do that 5 or 6 times. Baby should hopefully like that. Then you will pick up baby's left foot and match up where you left off here and pick it up here. So now you're on the medial side, just above the heel, and you're going to take your finger and go right across to the outer side and then down like a hook under the heel. Again, here, nice light touch, just dragging your index finger over to the side, down the side of the heel and around. Back to the medial side, across the top of the heel, to the outside, and down like a hook under the heel. So that makes a full large colon when you put them together, right? Okay, so that was the large and small bowels. And now we're going to massage the points for the esophagus and the mouth and the neck and the throat. So starting with esophagus and mouth, you go to the baby's right foot and you start about 1/3 of the way down on the medial side, the inside of baby. And with your index finger, you just sweep straight up and to the side of the toe and just do a little circular motion. So that's going up from the 1/3 of the way up, that's the esophagus, up to the side of the big toe, and about halfway down on the side of the toe at the bottom of the nail bed, you do a circular motion, and that's the mouth. And one more time, from that starting point up and to the mouth. And then of course, we want to repeat this on baby's left foot. So on the medial side, we'll start about 1/3 of the way down, and that's the esophagus, and you're going to go up with your finger in a sweep to about the middle point, and then just do a little circle around and around. Up and around and around. So that's esophagus and mouth. The next spots are neck and throat. Again, when you're talking about infant reflux or acid reflux, the esophagus has taken food backed up, and has gone into the throat area. And sometimes in this area here, it can cause a lot of burning feeling. So that's why we're going after the neck and the throat area in a massage. The neck and the throat are located at the joints where the toes articulate with the ball of the foot, and the throat is under the large toe. So you're going to be taking your index finger and you're just going to go around the side of the big toe and across where the toes articulate. So it's just a sweeping, very gentle motion. And then you repeat on baby's left foot, coming from the side of the big toe and around and under the toes. Like so. And the last 2 points of interest that will be helpful are the pancreas and the gallbladder. Again, on baby's right foot, and this time not on baby's left foot, because in our bodies, the pancreas and the gallbladder and the liver actually are all located on our right side of the body, in the upper abdomen area of the right side of the body. Therefore, we're only going to find these points on the right side, in the right part of the foot, the right foot. So first, the pancreas. So remember, we talked about solar plexus was right here. The pancreas is just slightly to the right, or I guess to the left, if you're looking at it from your side. This is where you would find the pancreas. So this is a little spot that it's very tiny, and you would just rotate your finger, your index finger, around very, very gently on that spot. So you're sort of right beside solar plexus. You're just circling with a little tiny bit of pressure, not very much at all. And then the last spot is the gallbladder. And the gallbladder is located on the medial side, sort of right along the same line as where the pancreas was, but in terms of it's in the upper part of the abdominal area, and it's like a square like this that you're going to cover this area right here. And the way I would do it is a grid. So it's sort of take your index finger and grid the area. So make grid lines like that. Again, very gently, like so. And we don't repeat, as I mentioned, on baby's left foot. So those are the key points, and I hope this has been helpful to you. So we looked at solar plexus, cardiac sphincter valve, large and small bowels, esophagus and mouth, neck and throat, pancreas, and gallbladder. What I really want you to take away is that this is a somewhat uncomfortable situation for your baby. And if baby is showing some signs and symptoms, it's very wise to go and get some professional help. Get your doctor, your pediatrician, to take a look and give you the diagnosis, give you the guidance, and make sure you follow their guidance and recommendations. And in the meantime, happy reflexology. I think you'll find it very helpful. Take care.